one right one, one wrong one, but that's okay. So we have an update. We have photos yesterday because like, well, 3/4 of the book is edited by the like EP team, and then it'll go to Shelby for the grammar and spelling edits, which I'm grateful for her for. So let's run through what we have. A little bit could change here and there as far as the order of things. I added procainamide yesterday because somebody said you should probably add that, so I did. And then they're going over AVNRT, AVRT, Flutter, and Ablations, which is on the back half of the book, and they're on that. Get rid of the shiny cover for a second. I am exploring some different options with covers, so we'll see what we decided for paper type at this time, because this thing is thick. So this is it's about 40 pages longer than the Cath Lab visual orientation manual, but it's cardstock, so it does end up looking like a lot more because I choose the thicker paper because, you know, some of you guys are in a rush and kind of flip through pages really quickly, and that can rip things. So I like the cardstock so that doesn't happen. So this is what we're at so far. And this part, about this much, nope, a little more than that, is what they're editing right now. Remember, oh, yes, and the cover. So this is actually Matthew, who's on the editing team. Johnson is his first name, Matthew's his last name, but he goes by Matthew, so I call him Mr. Matthew. And then we have, you know, devices and some different things on here. Thank you, Kim, for this awesome cover. Thank you for picking the yellow, because I wouldn't have picked that myself, but it's actually beautiful. And I incorporate all of these colors throughout the book as well. You know, I like some color coordination. I will throw up the table of contents up here, but let's just run through it, shall we? So in total, it is about 300 pages, 297 pages of content. And then we have a very special guest in the back of the book, two girls and their nonprofit, Heart Charged, that I have collaborated with before. We're both part of the cardiovisual group that we like to do post-Swiss and things. We don't get, you know, any money for that, but it's just like-minded people coming together, and they have a very unique patient perspective. Both of them have hypertrophic cardiomyopathy and ICDs. So one has had a subcutaneous ICD and one has a transvenous ICD. So I look forward to you guys reading their story about them, about the nonprofit that they do, because it's, especially if you get younger patients, right, who are getting ICDs, their family is great support, but the best support is someone who has been through what they've been through and are actively living with an ICD, and it gets rid of some of that fear. So definitely read it. I put a QR code there for the links to all of their socials and contact information. Please feel free to share that with your patients. That's what it's for. Oh, table of contents. All right, first up, we have a little bit of overlap with the Cath Lab orientation manual. And the reason is I definitely had to include radiation safety, room checks, sterility, consents, timeout, because if someone doesn't do any cath, they're not going to get the Cath Lab orientation manual. So they need that in the EP orientation manual. So if they only do EP, they're not missing all of that core information as well. Obviously, there's some stuff that is not relevant. So I removed that and put everything through an EP lens. So even some of the EKG lead setup, the control room, you have different things in the control room in the EP lab. So even though it might look the same, outside of really the radiation safety stuff, there is an EP lens through all of it. So the page might look the same, but if you read it, it's actually giving you different information. We have oh, and I already changed this. So remember, this is a draft. I'll put the a flip through of the final at the end, because I do like go through color edits, and if I feel like a page is just kind of a little bland, I'll add a little bit of something in there, or maybe some new information comes to light, and I can toss that in there as well. So the first section is where you're going to see all of that. Radiation safety, it does go over anesthesia, because anesthesia is a thing that's unique to the EP lab. So anesthesia, MAC, the different types of medications used in anesthesia, why it's important. Stimulator, right, depending on what you use, but all of them are kind of achieving the same goals. So, you know, getting thresholds, how to do the drivetrain, how to pace, where the extra stimulus buttons are, not buttons, but touch screen, you know what I mean. I also added a segment in here for zero fluoro procedures. I know not everybody is doing zero or minimal fluoro procedures in the EP lab, but it is talked about a lot at HRS. Some people shared their workflows, how they're using it, so I included that in there for you in case you've never seen it before, or maybe your lab is interested in doing it but didn't know how or didn't know if people were doing that. So that's in there. Medications that I included, this is important even if I know this is not specific to the RCES, but there's a lot of pharmacology on the RCES exam, so I did make sure to include quite a bit. So we have adenosine, amiodarone, Ansef, atropine, contrast because you might use contrast for venograms, epinephrine, heparin, ibutylide, isopril, oral anticoagulant, so all the DOACs, propofol, procanamide, protamine, sedation, of course. Holding medications when you may or may not, I know that's a little controversial, but I put everything that I could find in there. Antiarrhythmics, the classes, how to segment that out, and that's pharmacology. All right, anatomy, access, and closure. I know that's a bit of a random section, but I needed to put it somewhere. So conduction system, action potentials, coronary veins. There wasn't a lot of anatomy on coronary veins, and sometimes, you know, you plan to place the catheter somewhere and it goes somewhere else. So it's good to know where it is going and what all you are looking at besides just the coronary sinus. So I included that in there. Heart chambers and location. So like, where is the bundle of Kent? Where is the bundle of His? How exactly does that innervate in locations? What walls am I looking at when I'm placing my catheters? Access sheaths, a venogram, performing a venogram, what you're looking at for access usually. Sutures. So I included, I know you guys aren't like, don't suture too much, but I thought it was important. So I included purse string and figure 8 suturing, and then like some of the different symbols on the sutures. Perclose Pro Style, the blue one is the newer one. I have a little picture of the purple one, but I know that's kind of getting phased out. So I have all the step-by-steps for how to deploy that. The Minx, more Minx control venous, but again, step-by-step on how to deploy that. Vascade MVP, and Vascade MVP XL, even though all the deployment stuff is kind of the same. A little overview of the differences of that, steps for deployment on that also. Which I would have really liked, like Perclose especially really confused me no matter how many in-services I did. So I finally kind of built that in an approachable way, and I hope that helps you. Overall terminology for EP, I have terminology in some different sections where I think it's relevant for you before proceeding to the next section. So I have about 3 pages of terminology there. Implants. Implants is a big section because conduction system pacing is kind of a newer thing. Micra would be in implants as well. So I have terminology for that. Pre-procedure considerations like patient assessment, what they need to do the night before, things you may or may not need to hold, an overview of all of the surgical equipment, what should be on your table, how to handle some of the instruments, how to handle a blade, how to assemble a blade, important things that maybe someone does or does not go over with you. So I put it in here. And of course, all the retractors, the scissors, forceps, needle holders, pickups, all the different kinds, Bovie versus plasma blades, some of the artifacts that you can get with using it, why it needs a grounding pad, where the grounding pad goes, suction, fume safety. And then we get into the types of devices. So single, dual chamber, biventricular, of course. I did want to go over the EV ICDs and SICDs as well. So actually Aurora is one of the newer ones. It's the EV ICD implant, so it kind of goes right here. I did a full step-by-step on how to implant that, what you're looking for, both the lead and the can. Types of fixation, 12 lead setup for implants, because for the conduction system pacing, you're going to do a full 12 lead, and that can obviously kind of get in the way when your pocket is here. So I put that there. His bundle pacing, how to perform, what you are looking for. Left bundle branch pacing, how to perform, what you are looking for. Device settings, so pace sensing, rate modulation, multi-site pacing, all of that. And then we're going to get into like a regular implant right here in the chest. So you're going to have the full chest prep, draping, the IO band, full insertion steps. I showed it using a cut down because sometimes that can have more additional processes in it. So I just added the longer version. So then if it's a shorter procedure, you can do that. How to attach the leads, closure of the pocket and all of the options you could use for that. Different implant site options. A little bit on parameter testing, not to the fact of the rep, but more from the staff side when the rep is doing those things, what they're saying out loud, some of the terminology they're using, why it's important, what some of the parameters should be, just so you understand the nature of the conversation. Gen change, I know it's going to be completely different depending on where they are. Are they getting an upgrade kind of thing? Some, like you'll see with one of the heart charge ladies, they had a recall and they ended up getting one that was transvenous. So that's a very different type of gen upgrade, and even lead upgrade because it was an extravascular lead. Then implant complications, what it is, pneumothorax, lead dislodgement, air embolism, pocket hematoma. Overview of lead extraction. I know that's a little advanced, but at least wanted to talk about like some of the tools used, why it might happen. And then leadless pacemakers. I go over both Abbott and Medtronic's, but I do the full step-by-step for Micra because I think that is being used the most at the moment, and maybe we can add the AVR in the future. And then that's the whole first half. Then the second half is going to be all EGMs and all ablations. Okay, so we're going to start with the EP study, basic intervals. Let me show. Basic intervals. I should probably do this story time for kids. Your intracardiacs, some of the things you're looking for that people may or may not talk about, because I think what the signals look like, near field, far field signals, you really need to have a good understanding of that and of the component, the AHV and where it's coming from, and the normal order, in order if you're pacing from HRA, in order if you're pacing from RVA, to then have a good understanding of abnormal later on, distal signals, proximal signals, especially on a CS catheter, why that is coming from the left, why this is coming from the septum, why this is coming from the right. Then we go into an overview of the arrhythmias and categories like bradyarrhythmias, tachyarrhythmias, early after depolarization and delayed after depolarizations, what those mean, how that relates to some of these arrhythmias, an overview of fib flutter and ventricular tachycardia, of how to recognize it, treatment options are, and then we'll go into the how later, because not everybody is going to immediately proceed to an ablation, right? Okay, then you go a little deeper into the EP study, and we're going to go over equipment, steps, and protocols. So this is going to be your STIM protocols, or your pacing maneuvers. Okay, so we go over the different type of catheter options, catheter positioning, x-ray views if you're using x-ray. I know some of you are just using the mapping systems if you have the newer ones. Program stimulation, burst pacing, post-pacing intervals, drivetrains, extra stimulus, when you're using it, how you're using it, what an example of some of the protocols. NERTs and C-SNERTs, I know again, not everyone's doing that, but if you are, we go into it here over EGMs of what that looks like for the recovery times. Then we go into the refractory periods, what they are and what they mean, and again, some EGM examples of those pacing maneuvers and some different variants you might see in there as well. Winky-Bach testing, I think that was I know I'm a newbie, but that was my favorite one to learn about and try to draw out, because I did think it was, for a new perspective, it was a little complicated the way it was presented in some places. So I just kind of presented it in my own way. Ending with Winky-Bach testing and then going over a report sheet. I know not everybody has a report sheet, you just write it on a little sticky note, but if you're new, sometimes having a checklist of the order in which things might occur or what is important could be helpful for you, so I included that. And then the next part of the EP study, which can be a little difficult, are re-entry mechanisms, right? AVNRT, AVRT, atrial flutter. But again, if this is presented in a specific order where you really need to master some of this stuff first, and the normal of what you're looking for and how arrhythmias should respond to certain pacing maneuvers, to then go into when you suspect a patient might have an SVT, how to differential diagnose between those. So again, we're going to go through the typical presentation of things, right? Typical AVNRT, typical flutter, and then how to differential diagnose that between something that can look similar but is not that. So I'll talk about that in a second. AVNRT, I've presented in a few different ways because we all learn differently, right? What some of those pacing protocols might look like. Most of our focus is going to be typical AVNRT, so down the slow and up the fast. What we are looking for, what the jump looks like, what it means, what the parameters for that are visually when that conducts through the AV node, what that looks like, echo beats, some different examples of how different patients have responded to those maneuvers with AVNRT, VAV response, differentiating that from VAAV response, and how there can sometimes be like a pseudo VAAV response. AVRT, again, I know there's a lot of, it is hard when you're drawing it to show like what the patient presented with and then induction and termination of something. So I did my best with some examples that were provided to me from a pediatric lab. So thank you, because I know they do that more every day. You guys do more an adult AVNRT. Atrial flutter and differential diagnosing of that as well, right? Left-sided, right-sided, how to be able to tell what the rotation is, differentiating that from atrial tachycardia. So examples for those three. And then we'll go into the treatment of it in the ablation section, but that's more the differential diagnosis section of it. All right, left-sided approach. This was added more towards the end from some of your recommendations for transseptal puncture and some of the new equipment out there for transseptal puncture, as far as like the radiofrequency needles have been around, but the radiofrequency wires. I did go into that for you. Okay, so the different types of equipment available, how to perform a transseptal puncture with a needle, how to perform the transseptal puncture. I did go over the wire, right? Yeah, with the VersaCross wire is the one that I chose. I have all of them in there listed, but I just chose one or two to dive into. What that looks like on ICE versus TEE, how to tell that you were successful. Okay, some complications that can occur and early recognition of those complications. This is where I wanted to put the manifold prep, because if you're doing left-sided procedures and you need to transduce that pressure, you're going to have like a manifold or transducer, right? So I just do a quick couple of pages on that. Troubleshooting if you're against the septum or you're not getting a pressure, how to zero and balance and what that looks like, what artifact looks like. Okay, and then the treatment. So ablation. My goodness. Has this changed so much since I have started because of all the PFA stuff? And then, I mean, I love it, but like from a drawing perspective, when you have a plan and then like 4 devices come out during that plan, kind of derails it a little bit. But we got back on board. So I will tell you all of the equipment that I was able to include in here and go over. I know it's not everything. I know some of you in Europe are already using some of the devices besides Affera that can toggle between PFA and RF. I couldn't put everything in here, but I put what so far I have heard is being used the most. What is not in here is how to perform mapping. I want a separate expansion for that because it's a lot and all of the consoles are different. What I did want to go over are the patches and the placement of the patches for some of the devices, why you might use mapping, what it is, because if you're new, you might not even really understand that. So I do have the patch placement for the different devices in there because that's going to be part of your prep for ablation. Going over the different types, cryo, pulse field, radiofrequency, contact force, irrigation, impedance measurement, why some of that might be helpful. Steam pops, how to prevent them, what causes them, why they're a problem. And then equipment-wise, this is what I chose to include. So Q.micro, and this is going over what it is, some of the specs, how to prep it and how to use it, and then sometimes the generator if I could find information on that. Micro, again, brief overview of that, some of the settings, what you're looking for, how to prep it, how to zero it. Thermocool Smart Touch SF. I have a little excerpt on Dual because I know that's CE marked overseas, but it's not really here yet. Arctic Front Advance, how to prep and use it. That's a cryo balloon. Pulse Select, so that is pulse field ablation catheter. Spec overview, how to prep, how to use. Farapulse, again, how to prep, how to use, overview of it. Again, I know some of you are using some of the stuff off label, but I'm only talking on label here. Sphere 9, so that's the one that can toggle between RF and PFA. again, how to prep, how to use a Varipulse, pulse field ablation with cardio mapping and the contact force mapping, what that looks like. And then Volt. So this one isn't approved in the US yet, but it is one that when I went to HRS, one of the, I don't know what you would call it, one of the pacing stim device monitoring things is going to integrate directly with it. So it's going to show it on the monitoring screen instead of having a separate mapping screen, and you can control it from there. So I wanted to include it because I feel like that will change some of your workflows a little bit. So when it comes here, I at least wanted to include kind of what you're looking at and what some of that electrode feedback that's normally on the mapping system means on the monitoring system. So I just included a little bit on that. A little more into ablation, right? So now we're going to look at where we are treating, why we are treating in these areas for certain arrhythmias. Okay, cavo-tricuspid isthmus, mitral isthmus, pulmonary veins, of course, where the ablating the whole AV node would be, where ablating the AV nodal slope pathway would be, atrial, ventricular, epicardial ablation locations, where the fast and slow pathway actually is in the triangle of Coke. What that looks like, kind of how you know that you're correctly in that area. So then now we're going to get into the steps of how to, I know it's going to depend on what device you're choosing, but essentially we're talking about location and termination of these arrhythmias in the ablation anatomical section. So you're going to have AVNRT ablation, step by step, what you're looking for, what that looks like on mapping a little bit, direct AV nodal ablation, AFib ablation, sedation choice, anticoagulation choice, access that you need transseptal puncture, and then what your choices are, how to look for entry and exit block for bidirectional block, choice between floor and roof lines, and then atrial flutter, if it's CTI dependent or not CTI dependent for the cavo-tricuspid isthmus, what that looks like on mapping when you're looking for early meets late. And then electrograms, what that looks like. I didn't go too much into our PVC and VT ablations because there's just a lot more options that go into that. And as you see, we had to limit it to kind of some intro level stuff. I do want to make an advanced book. More on this will probably go in that. And I look forward to your feedback on what else you think should be included in a more advanced manual. Some of the unique cases that you might have found, submitted cases and their approaches. So I look forward to building that out. But I did just want to kind of do an introduction, like where is it located, why, how you would map that when you want to map, when they're in the arrhythmia. Okay, and then at the end we have complications. So we talk about two big ones with ablation, which is the phrenic nerve and the esophagus. So we go into that, some tools for preventing those issues. Effusion, pericardiocentesis, how to perform it. Thoracentesis, how to perform it. I have the dedication page for heart charged. So all in all, I hope this helps someone, again, from a first day perspective, or if like the Cath Lab manual, if you are a preceptor precepting a newbie and you're not sure the order in which to introduce things to them, that this helps guide you. Because I think, with all of these fields, the first year can be very overwhelming. And when you're doing a lot of different cases, and no two patients are the same, right? It can be difficult to figure out where to start to not get overwhelmed and to check things off as you're learning. So that's what this is really for, is to literally give you step by step from day one to get a good foundation. Look forward to growing with you as this field grows and as you give me feedback on what works in the order in which you learn. So this is a really, really great start. And I understand a lot more about EP now, and I haven't worked in EP. I built this team to teach me, and I feel like I could go in and do some cases and do some pacing maneuvers and have an idea of what I am looking at. When I see some of these electrograms online, when physicians share on LinkedIn, it makes a lot more sense to me now. So if I can learn it, you guys can do it. And of course, Shauna is there on the Don't Miss the Hiss. She was a huge part in making this book. Aaron and Matthew, thank you so much. And man, Aaron had to do like several actual sit-down classes with me because I mean, I was struggling at some point. AVNRT and AVRT was really, really difficult for me. And I do feel like I understand it a lot more now. So thank you to everyone who was so patient with me in answering my questions so that I could then put it in an approachable way to teach you. You got this. Please let me know what you think. I'm just very excited to give something to the EP Lab, who has been so patient in asking me for this for the last 3 years. And it did take me almost a year to get this, but I've already started on the mapping one. I've already started on the advanced manual. So as you give me feedback on this, we will be adding into those and hopefully make a whole collection for you guys through your entire journey so that there's a little bit of something for everyone. And I will insert a new day on here when we get the final product. Something is here. That probably hit my microphone, sorry. This is the sample. Finally, I know you all have been very patient. I haven't been able to pick a day because I was waiting for the final, sorry, fix my mic, too excited. I was waiting for the final sample for the new cover and back that I chose. Because I wanted something a little higher quality, because I wanted to get rid of the clear cover and the black back. Because this is the most pages I've had in a book, and it just needed a little more support. And I want to always raise the quality as much as I can while being able to maintain the price that I have. All right, this one might be a little too thick. There was one that was a step down and a little thinner. I am recording, but hi, this is my husband.
Oh, hello. I didn't even realise we were on.
I think it's a little, oh my gosh, I love it though, I'm so excited. Is it a little too thick? Let me get the other one.
That's great.
This is a little thinner one, but he said they were worried about supporting the spiral. I mean, like, I couldn't even rip this if I tried. Think about it, because when you have a hardcover textbook.
Well, I suppose it doesn't bend, does it? When you have a hard. Okay.
So here's.
Maybe I do this.
Right. So like.
Yeah, I mean you're not bending. Well, that's true. Maybe you're right. You should show Shauna.
Yeah, I was about to say. Let me give it to
Shauna.
Shauna, because she'll be honest.
All right. Peace out, guys.
Okay. Thank you. Okay, now I can do what I was going to do. So sorry for the interruption. But, let me move you down. Wow, what a chaos of a video. I'm so sorry, this was not planned. Okay, so if we're gonna go with this paper type, this is what we have. And now we have new official back. Thank you, Kim, for making that for us. I realized I should probably I need to move that in more. That's what we do proofs for. But I think you guys would like the larger paper, because like hardcover books, you're right, you're not sitting here like doing this. You know, I'm filming all the time, so I am holding it like this, but I know if you're actually reading, you're opening it like that. So maybe this one. But anyway, this is what it looks like, because we are finally done. And it's great. Of course, incredibly visual, because that's what I'm all about. Making it as simple as possible. EP is quite complicated, but I am very happy with a lot of the way that I was able to present things and interpret things, that I hope does tune you in instead of tuning you out, and makes it easy to follow in an order that makes sense as well of how you're layering on. So I am super, super excited. This is like the best quality book I've ever had. So I look forward to doing this with all of my others in the future as well. Drum roll. The time has come. So we have, first off, what we've been talking about, the EP Lab Visual Orientation Manual. This is a proof, but it is the final edition. Everything gets delivered on Monday. And we're going to go over the visual pacemaker and ICD expansion for the Cath Lab. This is the first time I kind of need to do a real explanation of my expansion compared to, we'll say, the hero product, the big book. Let's start with this first. So, some differences, if you saw from the video before, we did choose a new cover and a new back. It's been like a 4 or 5 month process in finding exactly what I wanted because, and I'm hoping to upgrade the rest of my books moving forward with some different variations of this, but normally we have the clear cover and the black back, and you will still have that on the books for right now. And we're going to test out with this, and I want your feedback on what you guys think. So not all the pages, but the cover and the back are waterproof. So you can wipe it with your purple wipes or whatever you use, depending what country you're in. If you're bringing it in and out of the lab and you just want to wipe it down, you can. Yay! And it is sturdy. So what happened was, this is the biggest book I've made to date. And normally I do everything on cardstock. And this is a kind of a thinner version of the paper, but a higher quality, because I had it in the normal cardstock I do, the normal cover and back I do, and it was super heavy and kind of hard to flip through because I had about 100 more pages than I normally do. So we upgraded the paper on the inside to a higher quality paper that is still sturdy and shouldn't rip on you, you know, don't be super aggressive, and then a sturdier cover and back to support the whole book, and of course waterproof so that you can clean it and wipe it if you need to, because you know the hospital is kind of gross, and if you're bringing it in and taking it out, I would want to wipe it down too, so you can. Now, content we already went over in the beginning of this video. I just changed around some of the colors of some of the sections a little bit from feedback from my editor on sectioning things out. Of course, we did our grammar edits and all of that, but it is completely done. Just one of my favorite visuals is actually in the refractory period section. I'm sorry, it's squeaking because it's new and hasn't been flipped through a lot. Okay, but I added these nice black visuals because I realized the black printed really well and the colors pop really well against it. So these are some of my favorite pages. So I look forward to you guys looking through this. I hope it draws you in, and it's going to seem overwhelming because it's a lot of information, but I did try to present it in a way and in an order when you're reading it in order that is not so overwhelming. So please look forward to this. It is not strictly made as an RCES study guide. We will be making an RCES study guide in the future, but for right now, because I don't have anything else, I did go through the topic list and make sure to include quite a bit of that information here. So if you are using it to study and complement, it does add to that. It is evidence-based, it is research-based and accurate, so that you can you're not wasting time, right? You have a supplemental resource if you want it, if it's something that resonates with you and you're taking RCES, by all means, use this intentionally for that as a supplement to a study guide. I actually added a lot of the medication and things in there, radiation safety I kept in there because a lot of that is covered on the RCES, even though you might not talk about it a lot in your day-to-day stuff in the lab. Same for EGMs, there's a lot of intracardiacs on there and like AVNRT stuff, even AVRT stuff. And if you work in an adult lab, you might not be seeing that all the time. You kind of just do AFib ablations most of the time. So please make sure to spend some time on those sections because it is covered in the exam, especially if you're not seeing it every day. And you might need to refresh your memory on some of that. So my Cath Lab people, pay attention. This is an EP lab orientation manual. So this is for 100% dedicated EP labs. This is for hybrid labs. If you're a cath lab doing EP studies and ablations, you do want this. What if you are a cath lab that only does implants? Because there's a lot of cath labs that do pacemakers and ICDs, and you don't do full EP studies. You don't do any of that stuff. any of the intracardiacs, any of the ablations. You're just implanting pacers and ICDs. Well, good news. Need the EP study stuff and ablation stuff, you are just going to get this book. This will have everything you need. This has all of the implant information, which I'll show you right now. All of this is the implant information. Now, I removed this for my Cath Lab people and made a separate pacemaker and ICD expansion based on your request for the Cath Lab. So for Cath Labs doing implants, okay? All of this is already in here, so don't get both. The only reason you would need both is if you're a manager buying for your labs and you have both a dedicated EP and your Cath Lab is doing the pacers and ICDs instead of your EP department. That's rare, but it does happen that way sometimes. Then you'll need both. Otherwise, doing EP studies, ablations, and implants, get this. My full-blown EP labs are hybrid Cath Labs. For my Cath Labs, doing absolutely no other EP except for pacers and ICDs, this is for you. This is already in here, so if you have this, you don't need this. But if you're the Cath Lab and you only do pacers and ICDs and you have no interest in any of the EP study stuff or ablations, this is what you're grabbing. If you are a P lab, you do full EP studies, all that fun stuff, this is what you want. How much is it and when does it launch? The EP lab manual is the same price as all of my other bigger books. It's going to be $219.99. This will launch August 31st at 3 p.m. Eastern Standard Time, and I'll put the other time zones here for you. This will launch at the same time. This expansion is 53 pages, and it is $42.99. This is the same clear cover black back cardstock that you are used to. And then this one is a lot. This is 300 pages of content. 302 pages of content and then 2 pages of a little dedication. I'm so happy to finally offer something for the EP lab, especially. Thank you guys for being so patient about this. I know you've been asking for it for a long time. It took me a long time to learn to then be able to present in this way. And then thank you guys from the Cath Lab for giving me this feedback that you wanted something just for implants. So please look forward to this as well. And yes, definitely grab this if this is something that you struggle with for the RCIS or you've never done a pacer in your life. This could be a helpful little supplement for you. As always, put any questions you have in the comments or email me at info@don'tmissabeat.store or DM us on any of our social platforms. Thank you so much. Please make sure you like and subscribe to this video. This is mostly a Cath Lab channel, but you never know. We'll be talking about any new EP products that come up, any conferences that I attend, and definitely go follow Don't Miss the Hiss on all of our social channels for all of your EP education.